High-quality CPR is cardiopulmonary resuscitation that meets performance metrics set by international resuscitation guidelines. When a patient in cardiac arrest receives high-quality CPR, their chances of survival and neurological outcomes improve. In fact, high-quality CPR makes it up to 4 times more likely that a victim neurologically recovers. Always remember to ensure the scene is safe and call 911 before starting CPR. If you can deliver chest compressions while you or a fellow rescuer is on the phone with 911, that is great. Otherwise, if you are alone and need to leave to access a phone, prioritize calling 911 over starting CPR. Dr. Benjamin Abella, Director, Center for Resuscitation Science, UPenn, describes the importance of high-quality CPR and how it directly impacts SCA outcomes. Components of high-quality CPR. In 2020, based on updates to the International CPR Guidelines, the AHA released updated guidelines on how to deliver high-quality CPR to adults. These guidelines offer 4 main metrics to meet to ensure the CPR you give to adult victims is as safe and effective as possible. Let's take a closer look. 1. Safe, supportive positioning and location. During CPR, your hands must be placed appropriately to ensure accurate and safe chest compressions. You should place the heel of one of your hands in the middle of the victim's chest toward the bottom third of their sternum. Fold your other hand over the top, interlacing your fingers to create a good grip. If you can perform CPR safely where the victim is found, do not move the victim. Ideally, you will perform CPR on a firm surface and the victim will be on their back. 2. Compression, rate, and depth. The recommended compression rate for high-quality CPR is between 100 and 120 compressions per minute. Rates above or below this range reduce the chances of survival of the victim. The American Heart Association has developed a playlist to help people remember the correct rate for chest compressions by using the beat of a familiar song. All of the songs in this playlist are between 100 to 120 beats per minute. When delivering compressions, the amount of time you spend compressing the chest and allowing it to recoil should ideally be equal. Leaning on the chest should be avoided between each compression. A person performing CPR should compress the adult victim's chest to at least 2 inches, but no more than 2.4 inches. For prepubescent children and babies, the compression depth should be 1.5 inches in infants to 2 inches in children. When doing CPR, focus on getting the compressions down to the correct depth. 3. Chest compression fraction, rescue breathing, and pauses chest compression fraction, CCF, is the proportion of CPR time spent providing compressions during a cardiac arrest event. When performing CPR, you need to minimize any pauses in chest compressions to have adequate CCF. The AHA recommends a CCF of at least 60%. That means you are spending 60% or more of the time delivering compressions. If you give rescue breaths, any pause you make for delivering them should be as short as possible, bearing in mind that according to the AHA, each rescue breath should last 1 second. When someone is in cardiac arrest, usually the blood oxygen levels are sufficient for at least 3 to 5 minutes, and perhaps longer. However, their blood needs help circulating what oxygen they do have and need to their organs and tissues. When compressions are interrupted for too long, there is not enough blood flow to deliver oxygen to important organs and tissues. 4. AED shocks. If you gain access to an AED before medical personnel arrive on the scene, make sure to turn it on and follow its prompts to deliver safe, effective shocks to the victim as soon as possible. High-quality CPR steps. There are some differences in how to administer CPR depending on the person's age or size. Infants, children, and adults each have different CPR requirements. Here are the key steps for providing high-quality CPR. Make sure the scene is safe for you and the victim. Check breathing and responsiveness. If there is no breathing or only unusual gasping and the person is not responsive, the person requires CPR. Call 911. If you're alone, find a phone and call. If someone is with you, tell them to call 911 while you begin CPR. You can also call from your cell phone on speakerphone as you begin compressions. Push, start compressions. Hands-only CPR, even if it's not performed perfectly, greatly increases a person's chances of survival. If you are willing, able, or trained in CPR, provide rescue breaths at a rate of 2 breaths for every 30 compressions during 1 cycle of CPR. Remember to keep pauses to compressions as short as possible and do not overventilate the patient. If you aren't willing or able to do rescue breaths, you can still jump in and help by providing hands-only CPR, which will still greatly improve the victim's chance of survival. After initiating high-quality CPR, the next thing you would need to do is administer a shock. When an AED arrives, deliver a shock if needed. Continue CPR until pre-hospital providers arrive. Conclusion: high-quality CPR saves lives. In fact, according to the American Heart Association, high-quality CPR is one of the most important factors to improve the chance of survival from cardiac arrest. That's all for today's video, and I hope you enjoyed it. If so, make sure to like, share, and subscribe to the channel for more engaging content.